So using this trusty assistant, I'm now going to show you some of the details of the bones that you'll need to know about for this case, the case of the football player with the injured knee. So this region of the body is the pelvis, so this would be the hip, and the bones of the hip would be the three bones of the pelvis. In many pictures that you see of the pelvis, it looks like it's oriented in the body like a big salad bowl. It's actually not. It's quite tipped. So if we look from the side, you can see that the front of the salad bowl would actually be here. And so it's a salad bowl that's resting on its side. So if we dropped a plane like this, it should intersect this part, and that would be the correct orientation of the pelvis. While we're looking at the pelvis from the side, this area, this depressed area here, is the acetabulum, and that's from a Latin word which means a vinegar cup, which was a popular drink in ancient Rome. So this is the vinegar cup, and the three bones of the pelvis, the ilium, the ischium, and the pubis, meet at the acetabulum and fuse. So it's a single bone now, but it developed in the embryo from what were three separate bones. So the ilium is here, the iliac crests are here, this is the pubis, which you can palpate in the front, and these are the ischial tuberosities, or the seat bones. The design challenge of the pelvis are three. First of all, it needs to transmit the weight of the entire upper body across the pelvis and down into the lower limbs and to the ground. It needs to contain or help contain the abdominal pelvic viscera, which are resting not on the bottom of the bowl actually, but on the side of the bowl. And at the same time, many of the large nerves and vessels for the lower limb and posterior hip region are emerging from the pelvis. So the challenge there is containing what needs to be contained and allowing what needs to leave to be able to do so. So that's the anatomy of the pelvis. So the pelvis is the bone of the hip region, is the pelvic girdle. The bone of the thigh is the femur. And again, as you recall from the very general introduction, the long bones of the body will have a proximal articular end, a distal articular end, and a shaft in the middle. This region is the head of the femur. This is the neck of the femur. And I'm going to turn the skeleton around a little bit so that on the posterior surface you can see the greater trochanter, which is here, and the lesser trochanter, which is here. And these are attachments for the big hip muscles, the gluteal muscles, that are coming down like this. So head, neck, greater trochanter, lesser trochanter. Those are features on the proximal articular end of the femur. Then it has a large shaft, very strong. And at the distal articular end, where the femur meets the tibia, we have two large condyles. So you're looking right into the knee, and you can see the smooth articular surface of the femoral condyles, and then kind of roughly reciprocal, you can see the two condyles of the tibia. So femoral condyles, tibial condyles, and then we talked about how around the condyle there's often a small area for small prominence. This would be the lateral condyle and the smaller epicondyle. This would be the medial condyle and the smaller medial epicondyle. And then roughly reciprocal, these would be the lateral and medial condyles of the tibia, where the condyles of the femur will fit, but not particularly well. And this is not what the patella would normally do when you flex your knee like this. So the patella actually moves up and down. The patella would be more like here. The bones of the crus are laterally the fibula and medially the tibia. The lateral and medial condyles we already mentioned. This feature is the tibial tuberosity, and that's where the big tendon from the quadriceps muscles with the patella interposed in it attaches on the tibia. So this is the tibial tuberosity, two condyles. This is the shaft of the tibia. And then just for a minute at your ankle, palpate these two bones. So this is the medial malleolus at the ankle, and that is formed by the tibia. Proximal articular head, shaft, medial malleolus at the ankle, so that's the bump on the inside of your ankle. At the proximal articular end of the fibula is the head. This would be the neck. This would be the shaft of the fibula. And then at the ankle, this prominence, which you can feel in yourselves, is the lateral malleolus. So together, the two distal articular ends of the tibia and the fibula will form a mortise joint that is the ankle joint.